Intermountain Dayspring Clinic in Logan, Utah, to talk about substance use disorder, especially around COVID-19 and what that means in this climate that we're currently in. Eric, thank you so much for joining us.
Sure. Thank you for having me.
So May is Mental Health Awareness Month, and I think it's really important to talk about what people might be experiencing during this time, especially when you're potentially isolated away at home and you don't have as much access to social interaction. So it's kind of where this topic came up. Let's talk a little bit about the term substance use disorder and how this topic is relevant to the current climate. And maybe can we explain to people what this topic really means as well?
Sure. Substance use disorder is the medical term that we've used to replace the term addiction. And we find substance use disorder to be a more accurate term and more helpful because the word addiction seems to really conjure up some certain stigmas and stereotypes, when in fact we know that addiction processes and substance use disorder processes are biologically based conditions that are treated with medications and counseling, and they can affect anyone from all walks of life. For me, also, I find in my mind that the term substance use disorder is helpful because it reminds me that it falls on a spectrum. The issue that somebody is struggling with. It could be a mild issue that's just starting to get in the way, or it could be something that has really gotten out of control and is starting to dictate a lot of how they act and really ruining people's lives once it gets to severe levels. Depending on the substance, the patterns of use, the degree of loss of control and their life impact, we will classify substance use disorders as either mild or moderate or severe. And that's based on how many out of 11 specific criteria are met for someone's substance use pattern. It is, I always remind people, possible to use substances responsibly, and we hope that most people do if they do use substances. But there are points where, when it starts to cross certain lines, we recognize that it becomes a big problem, and a lot of this behavior has genetic and medical roots for why it ends up occurring.
A quick question for you too on this topic. How did you get involved in working within this specialty? What was your reasoning for wanting to get involved with the Dayspring Clinic Logan? And maybe you can explain a little bit about what this clinic specializes in as well, so people understand that.
Sure. So probably 60% or so of our providers who specialize in addiction are psychiatrists. I myself am a board certified psychiatrist, so go to medical school, become a physician, then become a specialist physician in behavioral health. And then taking a step further, there's even a subspecialty of addiction psychiatry and addiction medicine, and I'm board certified in addiction medicine as well. So first, I became interested in mental health and psychiatry and began training there. And I happened to train out in New England, where, aside from West Virginia, they're the hardest hit region of the country for the opioid crisis. And so immediately, addiction treatment and substance use disorder treatment became just part of my everyday work. And one of my mentors out there, he was specialized as a substance use disorder psychiatrist, and he said, people get better, and that was why he liked it, and I agree. It's there's hope, and when people make that decision and work the program, we can really see people's lives turn around. After I came out here to work for Intermountain, as mentioned, I'm working in Logan, and we did not have at that point what we call a Dayspring program. Now, Dayspring is Intermountain's program for treating substance use disorders, and we have several in place already. They're in Provo and Cottonwood, and Salt Lake as well. So I helped to establish one of these Dayspring clinics up in the Logan region in Cache Valley. The Dayspring is part of the Department of Behavioral Health, which is great because that means it's staffed by board-certified psychiatrist physicians. We also have substance use disorders counselors, clinical social workers, and other support staffs like medical assistants and nurses. But particularly because as part of the Department of Behavioral Health, we're able to offer full service mental health as well as substance abuse disorder treatment, both at the same place. And we treat any problematic substance use, whether it's nicotine or alcohol, to opioids and methamphetamine and everything in between. And it's a major goal that the Intermountain has set, that they'd like to expand the Dayspring services to all regions of the state, so that individuals can be ensured the possibility to access quality care for substance use disorder treatment.
And this topic came up specifically too around COVID-19 because people are could potentially have more access to substances right now. I know that I've seen a couple of news stories out there that alcohol sales have actually increased 200% in Utah, which seems like a crazy number to me. Can you explain a little bit about why that might be something that people are reaching for, and what are the potential downsides of that happening right now?
Sure. And we often say that substance use disorders, it's a disease of isolation. It's something that oftentimes people try and hide, that they're ashamed of and they don't want to talk about. It's a disease that ends up leading to broken relationships, broken families, and often the person loses their job. They can feel ostracized. And at a time like this, when due to social distancing measures, which in the world of mental health we always emphasize, we should probably be calling it physical distancing, because we hope that we're still socially connected. It really increases the stress on individuals because they don't have as much in-person support from others who are in recovery. They might not have as much support from seeing friends or family as frequently, and that can lead to increased chances of relapse. And it's true that here in Utah, initially there was about a 2/3, nearly a double increase in sales in alcohol. And that was something that was also observed around the country about mid-March or so. And that was really when governors were starting to shut down. We're not exactly sure what the reason for that was. We think that much of that initial burst was probably a little bit of the hand sanitizer and toilet paper phenomenon, where people just were stocking up, and they were worried that it might not be there in the future, or that they wouldn't be allowed to go and make purchases and so forth. But even since then, it seems the sales seem to have slowed down, but they're still about 20% increased to where they normally are in Utah and around the country. And there's likely several issues that play into that increase in consumption. Probably among some of the top issues are just the anxiety that people are feeling at this time, and boredom. Also the fact that people aren't going out, so they're not driving, not partying, don't need a designated driver. So if they're at home and not going to be using the keys, then it's a little easier to open a bottle and have some alcohol with whatever it is that you're celebrating at home. People both use alcohol as well as many other substances as a means of kind of temporarily numbing uncomfortable emotions, and with people being stressed, that really leads to an increase. Also, for folks who are in recovery, we tell them boredom and free time are some of the most dangerous things that people can face. It's during those times when people don't have something planned, don't have something to do, their mind is wandering. It can tend to head back towards substances, and it's not just alcohol that we've seen increases in. Really, there are a number of habits at the moment that we've seen increased around the country. We've seen increased consumption of marijuana, pornography use, and online gambling even. So I guess pick your vice, and people seem to be kind of trying to cope with it, and by increasing the consumption of those.
I have a question to you about alcohol specifically. I know in the beginning, the state liquor stores in Utah, they're considered essential. They're deemed essential. They were open the entire time. And there was a lot of pushback from the public about why state liquor stores were considered an essential business. I think from my perspective, it was that it's probably a lot more harmful for someone who has a substance use disorder, specifically with alcohol, to all of a sudden not have access to it. Can you speak a little bit about that from your perspective? about how it can be hard to just cold turkey quit off of something and that it could be more harmful for someone potentially.
Sure. And really, of all the substances that are out there, alcohol is clearly the most dangerous substance for stopping abruptly. What ends up happening in the brain is essentially alcohol is a depressant. And even though it acts on many different systems, you've essentially got a balance between naturally in our brain activating chemicals and depressing chemicals. And so alcohol, as you use that chronically, shifts the balance. So there's more depressing chemicals than there are activating chemicals. So the brain actually adapts over time and says, wait, we're supposed to be in balance, and it increases the level of activating chemicals that are in our brain. And that becomes a problem, because if somebody were to stop alcohol, if they've been consuming heavily, just stop it all at once, you remove that depressing chemical, the alcohol, and all of a sudden you have an overload of activating chemical in the brain, and that can actually be life-threatening. It can lead to heart arrhythmias. It can lead to seizures. It can lead to something we call delirium tremens, and people can actually die of alcohol withdrawal. So I think that likely had something to do with the reason why the alcohol stores in particular were deemed necessary. In addition to that, there's always the chance that someone tries to make some moonshine or bathtub gin, and when it's not a controlled process, instead of ethanol, which is the alcohol that people use for consumption, if it's not controlled, they can end up with methanol, which is poisonous and can end up leading to fatalities, can end up leading to cases of blindness and so forth. And in states where cannabis is legal, they actually have said that cannabis dispensaries are necessary and kept those open. And again, has met with a little bit of a similar controversy about whether that's necessary or not. And there's certainly, unlike alcohol, there's not a life-threatening withdrawal. But I think that some of the concern that they have is that people might go out and start purchasing from illicit sources. And a lot of times, even things like cannabis that people are purchasing on the streets can be spiked with, we frequently will see fentanyl show up in the urine drug tests of individuals who've been just using cannabis, and so you don't know what you're getting out there. So I think it's kind of a public safety measure that they have decided to keep those in place.
Another thing about a particular substance use disorder that you could have right now is that there's other health implications that could be happening to you. I know that one of your recent interviews that you did, you talked about the benefit to stopping or reducing your substance use disorder right now, and how it could actually help you not get COVID-19 or have your risk of symptoms and illnesses related to COVID-19 be less of. So if you were a smoker and you kind of were decreasing your usage right now, it actually could be helpful for you. Do you want to talk a little bit about that specifically?
Sure. And it's hard for us to say specifically for COVID-19, but we do definitely have larger patterns with other illnesses, which we believe extends to COVID-19 as well, since it falls in these categories of diseases that affect people in predictable ways. But really, there's never been a better time to quit substances than right now during a pandemic. We know that, for instance, any substance that is smoked, that can lead to pulmonary problems in lung function. It can lead to inflammation. It can make someone more susceptible to respiratory illnesses, and we believe that's likely the case as well with COVID-19. And we know that other substances, though, even ones that are not smoked, but taken through other mechanisms, such as chronic opioid use or chronic alcohol use, those also can lead to a weakened immune system and decrease your body's ability to fight infection. We know what we see happen in the brain chemistry is that when someone is using a substance chronically, what we see happen is the reward center in the brain is repeatedly overactivated. And in turn, it actually activates a compensatory counter mechanism that pushes back on this high level of reward chemicals that the brain sees. It's called the anti-reward system, which is essentially the stress system. And we know that when the stress system's overactive, when someone's got high levels of cortisol and so forth, it suppresses the body's natural immune response. And I mentioned earlier, there's really not a better time than right now to quit substances, both for your mental and physical health, but also in the bigger picture of the risk that is being posed by the pandemic. We are seeing a lot of folks who are struggling. We're seeing more relapses, a lot of individuals kind of rationalizing, well, I'm under so much stress right now that now's not the right time to quit. But there are actually a number of folks that we're seeing who are taking this as a golden opportunity to stop using. They are determined, and they say, I'm not going out partying. I'm not going to the store as often. I'm not with friends who use so much. I'm kind of at home, and so I'm going to use this as a chance to limit my ability to go access the substance, and by doing so, we are seeing a number of people who are having some good success at overcoming their substance struggles during this time.
For those people that are struggling during this time too, what are some skills that they can use to start their recovery and start thinking about how to help themselves get better?
Sure. There are a number of different coping mechanisms that we employ in recovery, both in stress management and relapse prevention and so forth. But for those who are currently in the midst of a struggle with a substance and are thinking about starting recovery, I really my mind goes back to the 12 steps. And one of the first things is to recognize that you have a problem and admit it. And admit that this is a really strong and powerful problem that you can't take on your own. It's something that needs to be supported through others in recovery, and very often through professionals who are trained in substance use treatment. We may be socially distanced, like I mentioned, but we're still socially connected. So utilizing the connections that you have will be important. Once somebody's on that path to recovery, sticking with it, some of the skills that are very helpful, as mentioned, were stress management, time management, relaxation techniques such as progressive muscle relaxation, breathing techniques. Physical exercise is extremely important. Skills such as mindfulness, where you're living in the moment and really focusing on the here and now. Meditation. And participating in support groups, which is still happening. I have spoken to a lot of people who said, my AA group has stopped, and I really feel disconnected, and I'm struggling. The best resource that I found so far. It turns out most of the groups are still there. They've just gone virtual.
Right.
But the American Society of Addiction Medicine, so ASAM. They, if you Google ASAM support groups, they have a great reference page of recovery resources that their online meetings that can be done on video chat. They can be done on telephone in meetings. They have a number of podcasts that are very helpful for individuals that you can listen to on your own, and a number of readings as well that you can refer to on your own. So I've been telling people, Google ASAM support groups and see what resources are there that you could utilize for yourself from your home.
And you said that's ASAM support groups? Is
Correct.
that what they would do? Okay, I'm just going to pop that into the chat so that people can see that. Besides these support groups that exist outside of Intermountain too, how are people able to access care right now within Intermountain? Are there virtual visits happening? Can they talk to their doctor over the phone? What are some resources that we can really still help people during this time?
Sure. Yeah, and I think that one of the important take-homes is the recovery centers are still open for business, and we're accepting new patients and seeing people turn their lives around, even still in the midst of the stress of this pandemic. And a lot of them are more grateful than ever to find that this is a great chance to take advantage of these resources. The exact resources through which someone will find treatment is going to depend on the community that they're in. We hope that we're creating a no wrong door system,
Hmm.
but that might not be entirely the case right now. But there are several resources that are particularly helpful. If they themselves don't provide the direct substance use disorder treatment, they'll know who in your community does. So a good place to start is reaching out to your primary care physician. You can call the emergency department, and they'll often know who the clinics are in town. The county health department, community mental health center, a Dayspring program through Intermountain, even ecclesiastical leaders frequently know who are the good providers in your community. So these are all good ways to find resources where you live. And again, what kind of programs are available was going to depend on where you live, but
Hmm.
these are some of the doors that you can be knocking on to find someone who knows what's available where you live.
Eric, is there anything else you wanted to mention to us today about substance use disorder or anything related to mental health awareness for this month?
I guess I would just say substance use disorders, even maybe more so than general mental health struggles, is something that can be stigmatized and that it's hard for others to understand at times. And I would say to families of loved ones who are struggling with substance use disorders, don't give up, be patient. We generally expect to see some slip ups along the way. It's the
Hmm.
nature of the illness. So just giving them love and support. And for those who are struggling with the substance or who are on that road to recovery, staying optimistic, staying vigilant, and just keep taking it one day at a time, with hope and focus. And really, it's that's how we do it. We expect progress, not perfection, and there are a lot of folks who really are able to make a lot of progress, and so recovery is possible. So don't lose hope.
Well, thank you, Eric. And there's a couple of other resources too that Intermountain has as well. We have an emotional health hotline that people can also call. It's not 100% related to substance use disorder, but it's a support line that people can call. It's available 7 days a week from 10 a.m. to 10 p.m. That phone number is on the screen right now. It's 833-442-2211. We also have a specific section on our blog where you can view self-care blogs. There's stuff about mental health, physical health, and emotional health. And they're really great resources that you can even share with other people going through hard times right now. And related to COVID-19 too, we still have our COVID-19 hotline available. That phone number is 844-442-5224. You can get screened through our nurses there and then get told where to get tested if you qualify. So Eric, thank you so much for joining us today. We really appreciate the help and the support from our community, and we'll talk to you next time.
All right, thank you.
Thanks.